whole hour?
We are going like for 45 minutes and then maybe questions after.
Okay.
Yeah.
Okay. Fine. Okay, so good morning everyone. My name is Dr. Wahome Karanja. I am an ENT head and neck surgeon with City Health Hospital. We are conveniently located in the middle of the city center of Nairobi in the Odeon Cinema building off or along Tongoya Street. So for anyone in the city of Nairobi, we are certainly hopeful that you may be able to find us with relative ease, because Odeon is a landmark building, not just in Nairobi but also in our country. We have been in operation for the last 3 years, and we try to make it our business to review our patient experience. And to this end, we are certainly the most advanced outpatient facility in this part of the city, with advanced imaging, advanced laboratory services, fantastic and well-stocked pharmacy, medical doctors and specialist clinics, including our own for ENT. So it's a privilege for me to be able to share with you a little bit on mental illness. We are also key on utilizing technology through social media platforms, including Facebook and Instagram, to be able to bring information which we hope can be educational and also transformative for your utility. So thank you for allowing us that opportunity. And today the topic of discussion is in relation to mental illness, and with this regard we're talking about hearing loss and its impact on other chronic diseases. Did you know that when you do not hear adequately, that you actually run the risk of developing or worsening any chronic diseases that you may be having, either you or your loved ones? And not only that, that they can actually contribute to raising or increasing the likelihood of complications and even an early death. This is certainly a topic that has gained a little more momentum in the developing world, and is increasingly so within our population. We've also had a relatively good growth of knowledge in the field of ear, nose and throat and hearing. In our country today, we are able to do cochlear implants, which before were unheard of, and regionally we are obviously reporting increasingly improved results and a lot of benefits in terms of quality of life on those patients who get their implants. Now, to start us off, what is chronic illness and what is hearing loss? Now, hearing loss means that you have a significant reduction in your ability to hear. Hearing is one of those quiet or reported senses that largely can remain ignored, and that's the reason that you might have prolonged or long-term effects, because passing somebody along the streets, you may not be able to tell that they have a hearing loss, as opposed to being very quick to identify somebody who is blind or who is not able to walk well. Now, chronic means that you have had a disease for a long time, and chronic diseases tend to be what you call non-communicable diseases. So they are not communicated between person to person, and unlike, of course, corona or viral infections, bacterial infections and otherwise. These are diseases like coronary artery disease, heart disease, hypertension, asthma, diabetes. And they are also related to lifestyle choices that we make, the diet that we consume, and also age. And of course, with increasing age, then you are a more significant risk for lifestyle diseases. That also explains why in this season of coronavirus, that the people who are at greatest risk are those who either have comorbid or conditions which they are already being treated for, or are at an increased age. And that's why we say anyone above the age of 60 is at a significantly higher risk of developing complications or worse symptoms of disease, as opposed to those who are younger. Now the ear, and also when you talk about chronic diseases, many times you're talking about a disease that lasts more than 3 months or so, is not treatable but is actually manageable. You and most of us would know that people who are diabetic or hypertensives can lead a relatively normal life or quality of life as long as they identify the risk factors and remove them from their lifestyle or diet, and are also consistent and religiously so in terms of the medications that they take. So to just tackle hearing loss, which is our main focus for the day, the ear is divided into 3 parts. So there is the outer ear, which revolves around the pinna that we see externally, and going through into what is called an ear canal, and arriving at the eardrum. Now, beyond the eardrum, you have a middle ear cavity, which is an air-filled space that has 3 bones, the malleus, the incus, and the stapes. Now, the eardrum serves 2 purposes. One is to protect the middle ear from anything foreign coming from the outer ear, and the other important one is vibration or amplification. So it vibrates in response to sound waves that reach it, and those sound waves and that vibration would be amplified through the 3 middle ear bones, so that it is transmitting that mechanical sound or conducting that mechanical aspect of sound into an electrical impulse into the inner ear or the cochlea. Now the cochlea would also do some further amplification and stratifying of the sound that we receive or process from the ear through different frequencies and at certain loudness levels, so that through what is called the nerve of hearing, or vestibulocochlear nerve that connects with the hearing center in the brain, we are able to perceive sound. All these things are happening at a very rapid increase in speed. There's a lot of mechanical energy being transferred through some chemical impulses in the cochlea, and we're able to identify music, loud and sound which might be a danger sign or a warning, and many other impulses, including somebody who is cooking a favorite meal or things like those. So hearing as a sense is very, very key to our appreciation of the external environment. You can imagine when somebody is speaking to you and giving you a nice story and you're communicating, and there's a joke that will help you laugh, that is you are only able to appreciate that through hearing. If you're hearing music that lifts your soul during these difficult COVID times, and that obviously has a very positive impact on you. If you're hearing a child who's crying, you're able to pick them up and calm them down or feed them. So hearing is of necessity, not just for appreciation of life, but also to protect us from the external environment and anything that might be a scare. So normal hearing can be detected in anyone above the age of 5, and we're able to do that in City Health through what is called hearing assessment. Now, there are 2 kinds of hearing assessments. One is objective hearing assessment, which is something we're able to do in anyone who has achieved an age of 5 years developmentally or above. Why 5 years? Because this is an age where somebody is able to give you feedback. And the way we measure hearing is through hearing instruments which have a headphone in a very quiet environment with a very low external sound level that allows a reduction of feedback. So through the headphones, sound is presented at different frequencies and at different or increasing loudness levels. So anyone hearing from a sound hearing level of 20 decibels and above, so within this region here, at different frequencies, has normal range of hearing. Anyone who is between 20 and 40 hearing loss. Now, anyone at normal or mild hearing loss does not really require amplification. And on top of having a hearing evaluation or a hearing test that we do, your ear has also to be examined, and the external ear canal can be a point where you have certain abnormalities that contribute to what is called a conductive hearing loss. You may have wax that is impacting the ear canal. This commonly happens in people who are over cleaning their ears, and we are not supposed to instrument anything in the ears. The ears have a self-cleaning mechanism, and therefore we highly discourage any activity that puts in anything into the ear. Or one could have a hole in the eardrum, and there are, in our different tribes and languages, we have different connotations or names for that kind of hearing loss, where you have children especially having pus that drains out of the ears. Now, people who have this kind of what is called chronic otitis media tend to also have a hearing loss of which is conductive in nature and usually bordering around mild to moderate hearing loss. Now, for that kind of hearing loss, for example, certain measures can be useful. For example, ear cleaning, treating infections, sometimes even surgery that would repair a perforation of the eardrum that would therefore help to improve the mild to moderate hearing loss to significantly improved or normal levels of hearing. Now, if you have moderately severe, and even profound, which is what is considered deafness, these are obviously hearing losses that tend to revolve around not the conductive aspect of hearing, but rather also the electrical or the sensory part of hearing, which is involved in the cochlea. And this is what is called sensorineural hearing loss. Now, that may come with aging, which is called presbyacusis, which is a natural phenomenon, because as we age, our cellular processes of recovery and regeneration are reduced, and even the cells within the cochlea, which is the internal ear organ of appreciation of speech and language and sound, tends to age as well, and therefore with an imperfect regeneration, then you have definitely an irreversible level of hearing. Now, if it gets to a level where communication is a problem, then we do need to do something about it, and many times it may be through amplification from what is called hearing aids. Now, what are the most frequent causes of hearing loss? You typically occupational hearing loss. So people who work in noisy environments, our brothers and sisters who work, especially the Juakali sector, and they're involved in activities that generate a lot of noise without ear protection, then they are at a significant risk of developing hearing loss. Those who work in airlines or in proper masking or ear protection. There's also natural aging, which we've spoken about. There is heredity, where you might have hearing loss running within families. Head injury, which might also affect the nerve or the center for hearing appreciation. Ototoxic medications, commonly antibiotics in nature that may be given for severe infections like meningitis or tuberculosis, have also been found to cause some level of damage to neurons which are within the nerve, and therefore cause an irreversible form of hearing. And therefore, when these treatments are being given, it is important in the hospital or the clinical setting to actually monitor the effects of this medication on the capacity for one to hear. And also illness, severe illnesses, especially meningitis, and any illness that would be prone to take somebody into an either an environment of coma or where they are in ICU, has a significant risk for hearing loss. Now, how may hearing loss affect chronic diseases, and especially mental illness? Now, hearing loss has been tied to a rapid onset of dementia or Alzheimer's disease through plaques that may generate or be. You may find that those with hearing loss would have a much quicker development of forms of dementia, including Alzheimer's. And the risk is actually 5 times more with hearing loss. Those with diabetes, so persons with diabetes, because of the neural damage that diabetes brings through its activity on nerves, and also other damage to organs because of reduced glands, you may have the inner ear having a reduced supply of nutrients or nerve damage that would actually cause hearing loss. And we find that people with diabetes actually at a 2 times significant risk of developing a hearing loss. Now, what does hearing loss do that might predispose you to diabetes and other things? When somebody has significant hearing loss, they are disconnected from their external environment. What this means is that whether a child or a middle-aged person or even an older person who has previously enjoyed some level of external interaction. They can listen to the jokes that you crack. They're able to interact with you through a normal environment. When you have a significant hearing loss, what that tends to do is it distracts from what you have been previously enjoying. So even in conversation, you find that you're repeatedly asking your neighbor, what did he say? Or if people crack a joke, or if you're in a religious function, for example, a church activity, or in a mosque, or on some of the communication being said, then the environment. So you tend to avoid social interactions which will expose you for the hearing loss that you have. You will tend not to communicate because you do not want to be misunderstood, because you are also not getting a lot of that feedback, and that retraction and that kind of environment raises what are called stress hormones, cortisol and others. Now, if you have a right system, essentially what you are developing is a capacity to respond or to react to this highly stressful environment by having a multiplier effect on some of the stressful things that are already going on. So if you are controlled level of sugars in your body, so if you were previously well managed as a diabetic and hearing loss sets in, then you are more likely through that stressful situation to not be controlled diabetic. Then you are actually very likely to develop a level of abnormal sugar, more significant risk of developing diabetes. And it's the same reason why also cardiovascular diseases, hypertension and so on are either worsened or in studies show that 32% there is a 32% more likelihood in the older adults with hearing loss for hospitalization. This is also tied with a higher increase, a threefold increase in fall. The organ of hearing, or the cochlea, is adjacent or sharing or bordering the organ of balance, which is called the semicircular canals or the vestibular system. Now, when you have a hearing loss, especially in the older population, you are at a greater risk of having levels of imbalance. And that threefold increase or risk of falls is actually worsened in terms of its impact in the older population. Somebody who is above the age of having a significant injury, a major fracture to one of the major bones of the body, and therefore hospitalization for increased periods and a longer process of physiotherapy and rehabilitation. Now, you're already speaking about somebody who is getting disconnected, getting to be admitted in an environment where they are not enjoying their lives. So there is a higher risk of developing depression in these people. So anyone with hearing loss has a 3-time risk of depression as opposed to their partners who are of the same age. And obviously quality of life would be reduced. So you have a multiplier effect of all these hearing loss, of hearing loss on all the other systems within the body. Now, hearing loss actually has been found to have an increase of 43% likelihood of developing kidney disease. Again, it's because of the level of hormones or the level of stress hormones which are increased within the body. Of course, anyone who is at an increased risk of fall has a higher level of hospitalization, then has more likelihood of developing a mortality or even dying sooner. Cardiovascular disease is linked very clearly to hearing loss. Now, those with cardiovascular disease have a reduced blood supply even to the inner ear, and therefore those with cardiovascular disease will more likely develop a hearing loss earlier than those without. And those with hearing loss, again, because of the stress hormone levels within the body being increased, are also at a higher risk of either improper management of hearing loss or even the risk of worsening of the condition of a heart disease related to hearing loss. Now, fortunately, there is hope, and by this what I mean very well or adequately, then you are able to run a proper clinical test. So we can test the level of hearing, and we can be able to give a result to say, fine, you are not hearing properly, and at this level it is obviously contributing to poor quality of life, and it is already disconnecting you from the things that you enjoy and love to do. But fortunately, there is hope, and that hope comes in with amplification. We are able to determine if you need to amplify your hearing, you're able to actually get a hearing aid from as early as children, for example, the one that you can see displayed in that image, to those who are elderly. Now, the challenge with hearing aids, obviously, is the fact that they are associated with a significant relation to stigma. Now, and that is one of the most unfortunate thing about having to wear hearing devices. Now, if you are diagnosed with a set of spectacles and it looks like a fashion statement, elderly, the wearing of a hearing aid is associated with either the feeling of aging or quality of life and so on. And this is a stigma that we as a society need to sort of address and deal with, so that we are able to give or improve the quality of life. Hearing loss is not a death sentence. In fact, it is an opportunity to be able to bring back that enjoyed quality of life that can reverse a lot of these things we are talking about, including depression, anxiety, stress, cardiovascular disease, the risks of falls, and otherwise. Now, there are many kinds of hearing tests or hearing amplifiers. The behind the ear hearing aids, which you could commonly see, and there's one which is called a mini BTE, or behind the ear hearing aid, which is smaller, less conspicuous, and there are in the ear hearing aids and in the canal hearing aids. With the progressive reduction in size, occasionally comes a progressive increase in cost. But by and large, you would have, if you have a hearing loss type, you'd be wearing the kind of hearing aid that corresponds to what you're able to buy and what your real and immediate need is. For example, most people with severe to profound hearing loss may need to actually put in a behind the ear hearing aid. Now, there are many kinds of hearing aids or amplifications available. There are those that are called analog, which previously were made and available. Now, analog hearing aids do not tend to select the frequencies. They are not clever hearing aids. So in as much as they might raise the capacity to hear, they might not be a very comfortable wear, because they do not discriminate on the frequencies they raise, and therefore it is very easy to actually also get noise feedback on a hearing aid that you use. Now, the more cleverer or the digital hearing aids that we have available, which tend to be slightly more expensive, are also more intelligent and more favorable to wear. They also have features within them inbuilt that can help, because many times you find people with hearing loss complaining that they're also having external or internal sounds, what is called tinnitus, a ringing or a swishing sound or irritation that comes alongside with hearing loss. So many of these digital hearing aids also have what are called tinnitus maskers, and this is an element or a feature of the hearing aid that also cancels out that offensive noise or feedback that you tend to have, and therefore obviously raise the quality of life. So when you put in a hearing aid in somebody who has had a progressive disconnect and therefore also mental illness that's complicating their life, depression, anxiety, and diabetes, hypertension that's being increasingly becoming difficult to manage, when you do is not that you restore their hearing, you actually reconnect them back to life. In fact, a lot of the clients that we see, when they have that immediate switch on, the first thing they respond to is they give you a smile, and after the smile they tell you, you've not just given me, you've really not just given me the capacity to hear again, you've actually saved my life. So I think with that, maybe we can open a little bit to a more interactive session. Happy to take in questions. We have a fantastic team behind the camera who are also looking to see what the queries are. So I think as they come in, if you send in your text, I'll be able to respond to them quickly and hopefully in as detailed a manner as possible. Thank you.
So maybe the first question is, for adults, it's easy for them to tell you that they are not hearing, and you are able to trace it. But what happens to small kids who do not know about it? How do we tell that this kid enyewe husky?
Okay.
Yeah.
That's a fantastic question, and thank you for raising that. Yes, adults or even older children are able to communicate their feelings. They can be able to communicate pain. They can be able to say, my ear hurts, or I cannot hear you properly. In younger children, from birth to around that age of around two years, these are not able to express themselves, especially if they had what is called congenital or born with hearing loss. So one, remember there is a hereditary influence on hearing loss. So if you have a family history of hearing loss, it is obviously important to be very keen with children within that family to be able to ask and assess and see, are they crying normally? They turn in the direction of the sound. When you give them an instruction, do they look like they're communicating with you? Do they appear to hear? And earlier on, you look at their social interactions with children at play. It can be able to tell you that there is some level of hearing loss in this child. And when that can be picked up, especially if there is a speech delay, at the age of 2, most children should be able to say mama, baba, or in whatever language. So if you find that there is a speech delay, then you certainly want to do some level of hearing assessment. We are happy to have a look at them, or your pediatrician or any doctor who can be able to assess. You can be able to do quick and simple trials, for example, rubbing your hand around the ear, clapping without them noticing. And if you see they are not turning in that direction, then you want to do a proper hearing evaluation, which we are happy to do as well.
So that question was repeated. So there is someone else who has asked the same.
Okay.
So we are getting feedback from Wangema. Then Jen Kagwiria, she's saying she's coming, so you should not leave. And then there is Wangari Chege, very informative, also same as Johnny, very informative doc, keep it up. So Njokingore is asking, can prolonged use of hearing aid cause any problems?
Thanks Joki for that question about prolonged use of hearing aids. Contrary to popular belief, so one of the queries we get is, okay, fine, I have some element of hearing, but when I'm in a bigger environment or in a social gathering, I cannot hear what my neighbor is speaking. So conversational speech in a noisy environment is is difficult for me. But when I'm one-on-one without that external noise, I tend to communicate. So I'm somewhere in between whether or not I should have a hearing aid. So if I put on that hearing aid, will it not further worsen my hearing loss? And the answer is absolutely not. If you're using a proper hearing aid, all it does is optimize. Is there a likelihood that your hearing will be improved without the use of a hearing aid after using a hearing aid? The answer is no, but it will certainly not be worsened by the hearing aid. It will actually be improved. Now, if I'm hearing worse on one ear, which tends to happen, both ears may not have the same level of hearing loss, then do I need to wear 2 hearing aids? And the answer is yes. Most times you want to wear both, and the reason is that is why we have 2 ears. There is bidirectional appreciation of sound, or binaural by oral input. You want to be able to hear with both sides, from both sides of your head, so that you can be able to pick out where sound is coming from. This is also protective, like when you're crossing a road, you want to know, even through the feedback, that there is actually a car approaching from this direction and so on. And you are also able to have an improved or better balance and appreciation of the external environment, including music and sound if you are in a social gathering. So yes, you may need to have 2 ears, but putting on 2 hearing aids, but putting on hearing aids does not worsen your hearing loss at all.
So the other question is, for the young people, we are so tentative of putting on earphones or headphones,
Right.
and we love loud music.
Right.
What would be your advice to those of us who?
Okay. With the advent of mobile telephony and of course headphones and earplugs and music, and the youth we are actually having a mini pandemic in our hands. There's a lot more hearing loss being reported in the youth. This is people by definition from as early as 12 years to 35 years of age. And this is the group that has taken up the use of earphones or headphones aggressively. They put on headphones or listen to them in the public transport, when they're doing their workouts, when they're walking on the streets, when they're working in the office, especially now when they're working from home. And earphones, earplugs have actually been found to cause a significant risk for hearing loss for two reasons. One is they are mostly plastic in nature, and therefore they are ill-fitting. Unlike a hearing aid, which is built for your hearing canal and therefore snugly fits, most earplugs are more loose in the nature of fitting, and what that does is it allows external sound to actually compete with the volume or the sound that you're hearing, so music, news, and otherwise. So you tend to want to raise the volume so that you cancel out that competing external sound. So by definition, you will listen to louder sound by using an earplug than if you were using a headphone. So advice is one, reduce the duration of time that you are having to use earplugs as much as possible. I would recommend not to listen for more than an hour continuously, that you need to have ear breaks in between. Listen to external sound. If after removing the earplug you have a ringing in the ear, you are not unlike anyone who went to a very loud disco and the following day they had ringing in the ear. If you get ringing in the ear, know that those are already warning signs that you're already exposing your ear to some level of noise-induced hearing loss. And preferably, if you must listen through directly, then I would prefer to use headphones. And the reason is headphones cover the ears, they mask the external sound, and by definition you will use less volume to be able to appreciate the music or the sound that you're listening to. Having said that, do not walk or jog outside with headphones or earplugs. It is important for you to appreciate your external environment, because then you can run into an accident, you can get yourself into impending danger, so you lack the protection by covering your ears in an exposed environment. So yes, use less of those earplugs as much as possible, use headphones if you must, and regulate the volume that you're listening to.
Thank you very much, Dr. Now, two questions. Now that kids are home, we'll talk much of ear hygiene. First thing it talks about nothing should go into our ears, right?
Correct.
So we more or less find people using earbuds to clean their ears.
Correct.
So is it correct for them to use earbuds? Because from childhood, that is what people know about it.
Correct.
And then the next one is with the kids, like let's say from ages 5 and below, they like putting things in their ears. So if a parent notices that a kid has put something in their ears, what is the appropriate way? Do they remove it themselves, or what is the procedure to at least the first?
Nice questions. I'm happy that we are getting those. Children are at home now. I know parents, obviously this is a challenging time, but it's also an opportunity to bond with children if you have that opportunity. Now, remember my description of the ear. So you have your outer ear canal, and the outer ear canal, most of it actually has a surface that produces sebum or wax, and has skin that is very similar to the skin of our external skin. Now, our bodies keep regenerating. The skin that you had last year is not the skin that you have today. Same as the ear canal, so that it is regenerating by falling off, so to speak. Now, when you put in a cotton bud in the ear, you come out with a definitive smelling amount of wax, which is a mix of that wax that the ear canal produces, as well as the dead skin that is shedding. Now, there is also a few hairs on the ear canal that help with the movement or exit of this combination of the wax and dead skin. So the skin of the ear canal is self-regenerating. The cleaning mechanism is perfect on its own. It doesn't need to be aided. So our advice is, do not put anything into the ear canal, because when you do, what you're actually doing is you're going against the normal mechanism of cleaning. So you're actually pushing in wax. You may come out with someone say, oh my goodness, I've cleaned myself very well, but in essence you've brought out some and pushed more in. And also when you're bringing that out, you're also cleaning off the wax. Is actually antibiotic and protective. When you clean it off, then you're exposing that ear canal skin to the likelihood of infection. If you also end up swimming or having some water getting in, you have a very increased risk of developing infection in that ear canal, boils and otherwise. So do not clean the ears. If you have cotton buds at home, please throw them away. The other risk that you have is, as you put in anything instrumental, a biro tip, a cotton bud, you actually have a real risk, depending on the length of the ear canal, of perforating or injuring your eardrum. And if you do that, then it can give you problems that are much more than you may have anticipated. Now, children, rightfully so, below the age of 5, love to experiment with foreign things. One of the things, especially in girls, we see our ladies trying to make them look pretty by putting ear beads on their braids and so on. We, as a profession, really fear and advise against those instruments. So the small toys that have movable parts like vuvuzelas can easily become foreign objects in the airways and also in the food pipes of children when they are at play. So we advise, do not have, examine the toys that your children are playing with. If they are girls, try as much as possible not to put beads in their hair if they are below the age of 5, because these are the same beads that they will try to put in their mouth, they'll try to stick in their ears, either themselves or those that they are playing with, stones and pebbles and others. So one, if you find that your child has actually put in something in the ear, find out what it is they put in. So it might be something organic like dengu or beans or maize. Organic things tend to take in moisture and they will expand within the ear cavity. Others like beads or a piece of metal or a ball bearing and stuff will remain in terms of the same size. Now the ear canal is quite friendly in the sense that you do not have an immediate risk unless it's a very corrosive thing like a battery. Batteries will absorb moisture from the internal environment, and these are batteries within, say, small digital devices like watches, and they can corrode the ear canal very, very quickly, or any other area. So find out what it is that they've put in. If it is a bead, then you can sleep the night, and you can give a painkiller if they're actually in pain, and during this curfew time, the following day, go to a hospital where you're likely to have somebody who will be able to have the right instrumentation to pull it out. The real risk of trying to instrument is you can actually push in the foreign body further, and it can get impacted, cause a bit of trauma or damage to the ear canal, and therefore obviously pain. But if it's not painful, wait it out, go to the hospital, let the experts remove them from there, and you'll be fine. And of course, try as much as possible to.
So there is a question from Wamaida Karanja-ENT, harmful in any way?
Thanks, Wamaida, for that question. Earplugs are very useful when you're swimming. There are those of us who have developed swimmer's ear. As ENTs, we see a lot of patients in January after the holidays, because again, in the December holidays there's heat, people take the opportunity to swim, some go to the coast. Now, the humidity using swimming pools that sometimes may not have been completely clean predisposes to the risk of ear infections, what is called swimmer's ear. Now, when you put in a swimming plug, which are commercially available, we do have them at City Health, you can get them in many or most pharmacies. You can be able to, what you're actually doing, and they're malleable, yeah, and they expand and they do not go completely into the ear canal. What they do is they stick on the ear canal surface and therefore do not allow water to get in. So if those who swim a lot, so professional swimmers, athletes, and those who swim for recreation many times, we would advise them to use swimming plugs, because the swimming plugs just plug the ear and then water does not get in, so the real risk of developing do not cause any damage. They are completely beneficial.
So the other thing is sometimes you feel that your ear is itchy, and you have advised us to do away with the earbuds.
Correct.
So what's the right way to go about it then?
Okay, so the external ear skin is continuous with the external ear itself. So if you imagine, if you pull the ear upwards or here, you're also sort of manipulating the external canal skin. So what we say is you could do this, okay, or you could rub the ear external into the ear canal, regardless of how itchy it may be feeling. And in fact, that's why we say the adage that the smallest thing that should get into your ear is your elbow. I mean, you can imagine putting in your elbow into your ear. That is basically a detraction to put in anything in the ear. There are home remedies, and that's the good thing about that question is then it gives me an opportunity to talk about them. And there's the old wives' tales about using so on. As a recommendation, olive oil is probably the best that you can use, but olive oil is expensive, not readily available anywhere. And some places you may not be able to have it. But if you can find a good sunflower vegetable oil, that tends to be okay. And we usually advise that you could even warm it, but there's a difference between what is warm and what is hot and can actually cause ear damage. And so if you can stick it at the most vulnerable part of your skin, like the inner arm skin, and you pour a little bit and you feel that it is just comfortably warm, that is a good thing to actually put in the ear. And that helps in two ways. One, it reduces the itchiness or irritation. It also breaks down a little bit of wax that may be impacting and therefore helps it to come on. And something you can use in children or in adults that can really generate normal skin in the ear canal, reduce itchiness and so on. There are those amongst us who have allergies that extend into the ear, like eczema and so on. So again, it's good for you to have a general treatment of that eczema, either through anti-allergic medication or antihistamines, some occasional steroids. So I would say for sure, if it's something that is continuous, very irritating and affecting a lot of the skin of the body, I think it would be good to actually have a medical evaluation. We're happy to see that.
Yes, thank you, Dr. Now, there are those people who tend to have so much wax. How do they do their own ear? Yes.
Okay, so enough wax for the needs of the external ear, and they will never need to see an ENT because of wax issues. But there's still a small component who overproduce wax. There's those who have a lot of hair in the ear canal that blocks out the normal movement of the wax, especially amongst the elderly. Now, one of the signs of wax buildup obviously is an increasing hearing loss. Your ears feel blocked and uncomfortable, and after a shower, because of water also getting in, that can also expand a little bit of the wax that's already built up within the inner ear. You can actually have a full blockage. It's very uncomfortable, and we see a lot of these. Now, when we see somebody who has wax that is impacted, what we usually do is cleaning, and there's many ways of cleaning the ears. We can syringe through using warm water that flushes out the ear canal and brings out the wax, and then we clean out the water that may be remaining. It's usually a fantastic feeling. Again, many people say, I feel born again, especially if it has happened after a long period of blockage. And there are those that we have to do the cleaning because they overproduce wax. They were just built that way. Now, as a recommendation, what we usually say is, of course, stop any instrumentation, come regularly for us to clean. But from our experience, we find that if we clean regularly and we advise good ear hygiene, then they tend to come fewer and fewer times. And by good ear hygiene, what we talk about is a vegetable oil that helps to soften wax periodically. There are wax softening medications that we have that can be able to be, that you can put safely into the ear on a regular basis, sometimes as often as once every 2 weeks or 1 month. And what that does is that it breaks down the wax and removes. Some have very narrow ear canals that makes it more easy for the little amount of wax building up not to come out easily, and therefore they need cleaning. But there are those that follow ups because of that, but they are usually fewer.
Thank you. Now, 2 questions. The frequency of ear checkup for the young ones, like the kids, the youths, and the elderly.
Okay.
So how frequent do they have to come for ear checkup?
I would say in children, one of the most useful avenues is schooling. There are school-based programs that check hearing and so on. But a good interaction with the school teacher of children would be able to tell you if this child is hearing well or not. School performance, interaction, and others will tell you already that this child may not be hearing. There is a condition called otitis media with effusion. What that means is the middle ear cavity is filled up with a common problem. In fact, most children below the age of 5 will develop, usually following an up. You have a buildup of fluid within the middle ear, because that explains why when you're taking off in flight or landing, sometimes you might feel pain in the nose, and if you yawn or push against your nose, taking a long distance journey on a bus or in a car, sometimes you feel like your ears are sucked in, and when you yawn or chew gum or pop your nose, you can feel like your ear has popped. It's because of that eustachian tube. Now that eustachian tube is smaller in children and wider. That means then the usual suggestion is, if a child is getting recurrent upper respiratory tract infections, they need to actually have some nasal obstruction, or they actually exhibit signs of no hearing, then I would say they need to have a hearing check. In developed countries, there is actually a universal hearing screening that screens every child the same way we do the first vaccine before they leave the hospital. These children undergo a universal hearing screening. We are yet to develop a universal hearing screening program for the country. We do it in our clinic here, and we are happy to do that screening for the children who come through our antenatal clinics here at City Health Hospital. Now, in the old above the age of 50, I think it would be a hearing evaluation, and especially those who are diabetic or hypertensive, I think it would be prudent to actually have that hearing test, because again, if you catch a hearing loss early, you can prevent its rapid progression by amplifying early, and of course raising the quality of life. And remember, even from our discussion, it can go a long way in terms of helping to manage the comorbidities, which is the diabetes, the hypertension, preventing depression, reducing or slowing down the development of Alzheimer's and dementia and those kind of conditions.
Thank you. For the society, or rather for the community, how can they factor in or care for the people who have a hearing loss or tend to have a mild or a severe hearing loss?
So good thing is that we have, across the country there are trained audiologists and ENT surgeons who are spread out in the country. So regardless of where you are located, especially now during the curfew, I would say it is possible to get an ENT surgeon or an ENT clinical officer or medical doctor or clinical officers who might be able to advise on an area where you can have hearing testing. There are many non-governmental bodies who are engaged in ear health and also eye health, and they are also responsible for giving out hearing amplification devices or hearing aids at a reduced cost, sometimes even for free, to some of these marginalized communities and some of those very needy children. The Kenya ENT Society, and also through other partnerships, there is an non-governmental organization called Operation Eardrop, which has been working and continues to do great work in terms of identifying children who have chronic, children and the young who have chronic ear disease. So that means they have long-standing disease, especially the one that we had described of pus coming through the ears associated with hearing loss, and they are consistently and constantly seeing these children in different counties, and also here in Nairobi through Kenyatta National Hospital, where they evaluate these children and actually give them free surgery through that organization. And so there is many places that somebody would otherwise not have the means to be able to either afford a hearing aid or treat a chronic ear disease, can be in Nairobi and even in the counties.
So a question that's related to that also, you talked of hearing loss can lead to something like depression, and from my seat, what I think is maybe we are cracking a joke and then I didn't hear, so you people laugh, and maybe I ask, what did you guys laugh? Then you push me off, so I withdraw. So with families with this kind of people, for someone who is going through the hearing loss, what is the advice that you could give them?
Thanks for that. Yeah, certainly hearing loss disconnects And by disconnecting, what I mean is, again, social interactions cease to have the joy that they probably once brought. In terms of, for example, just understanding a joke, or being able to communicate well. Many times when you are repeating to people that please repeat, or to say please repeat, people get that fatigue and they do not want to interact with you every so often or clarify themselves, and they can brush you off, and that tends to make you withdraw. My advice to those families is hearing loss is real. It is, and that's why we need to recognize it as a real problem. If you are a working professional in Nairobi and you have your parents up country and your mom or dad, you are increasingly having during this COVID crisis, where you find they are very abrupt in their speech. They are giving you answers that do not look like they are completely tied to what you had asked, and they are really reluctant to keep talking to you as often as they did before. They are likely to be having a hearing loss. So guess what? It is not just hearing loss that you're dealing with. You are now dealing with the onset, if not the build-up or worsening of that isolation that is brought about some level of depression, and will quickly lead them to have other complications that we have discussed. And therefore you need to be very understanding, and you need to be able to get to the root cause of what's going on. Let them have their hearing assessment, let them have their hearing aids, because then you're not just reconnecting them, you're saving their lives. And so the families need to be very understanding around this condition. They need to help these elderly or even children who are undergoing hearing loss. So that kind of preparation. Now, the person with hearing loss, again, the challenge is the stigma. I think once it is identified, if you realize that you're straining to hear and you consider yourself, especially not to be in that age group of the elderly or the aged, it could happen. There are children who do not hear well. So if you're 35 years of age, you are happy in your profession and you realize that you're not hearing well, face it, there are solutions. There is a solution for you. You can find help, and that help can really change your life and prevent the build-up of other complications that we've talked about. So just be brave and take it on, and it will probably save your life.
Yes. Thank you. Now, someone is asking for the different people working in different industries. Let's say the guys at call centers, the guys who working in factories. How do they balance? Because sometimes that 1 hour break, they can't get it because it's a back-to-back on call always. That whenever they leave the station, they find that distortion, some of the sort. Are there some remedies that they can use even on call before that break to enable them have a conducive hearing environment?
Yeah, the immediate and of course, like many organizations utilize call centers. I think the immediate response, and of course there is regulation around, and there are things called OSHA, which is the Occupational Safety and Health Awareness, and so on, those activities. Now, the first thing is to be provided with the right tools to utilize. So proper hearing devices that give you high quality sound, that is not noisy, regularity of the breaks that are prescribed, that they need to be taken in between, and of course after a certain number of days they need to take that break away from that physical environment. They also need to have regular annual checks so that they are not developing other complications like what is called acoustic syndrome, whereby you have a little bit of damage that can even be reflected as a psychological upset, anxiety, and so on, and pain and irritation. So you need to have at least annual checks if you're working in a noisy environment or a call center situation. You need to have a regular update of the equipment that you're using to make sure that it is ideal and protecting you. And if you're working in a noisy environment, not necessarily a call center, you need to have appropriate hearing masking devices or earmuffs that protect your ears. And it is your right as an employee in that environment to receive that kind of care from your employer. So of course, just visit your HR, have these discussions so that you're sure and confident that those measures are being implemented for you and your colleagues at work.
So is that up? You can thank the audience.
Our audience.
So mine is to say a very special thank you to all those who have managed to join, those who probably will tune in to see the presentation and the talk. It's a real pleasure, and I really hope that it can touch just one life, seeing you doing those tests, improving your quality of life. And I wish, obviously, all of us and our families safety and good health. Keep sanitizing, keep washing your hands regularly, maintain that social distance. COVID is real and can be defeated if we are working hand in hand with the government to be able to do the things that we should. I am not wearing a facial mask, not in, I am not fighting the need, but it's because I have socially distanced and I wanted you to see my face. But otherwise, as a constant, I have to put on a mask as long as I'm in public. Thank you so much for joining us, and God